to Helius Medical's channel, a leading neurotech company in the medical device field, non-invasively improving lives of people dealing with neurological diseases. Joining us to give us a high-level overview of the company, a little bit of his history as well, we have Dane, the Chief Executive Officer. First and foremost, welcome, sir.
Welcome and good morning, Kyle.
Yeah, a pleasure to get you on in this fascinating industry that you guys are kind of tackling here to really kind of help people solve quite a few neurological issues. But first and foremost, for newer audiences, do you want to give us a brief elevator pitch to Helius and its device?
Yeah, Kyle, thank you for the question. Balance and gait deficit is one of the most common symptoms across neurological diseases like MS, like stroke, and even a trauma like traumatic brain injury, a hit to the head. So most of those patients that have a balance or gait or walking deficit will go right into rehab. And what PONS therapy does, it's an orally applied therapy that is used in combination with your physical rehab exercises. And it's a 14-week treatment.
Yeah, and I appreciate the insight. And when you're talking about kind of improving of gait in people with MS, I mean, you're talking about stroke victims. Do you want to give us an idea of the sector size, exactly what neurological diseases you guys are focused on?
Yeah, so right now in the US, through our first breakthrough designation that was granted by the FDA, given that the PONS device and PONS therapy is one of those emerging cutting technologies, basically, we got approved in March of 2021 by the FDA, authorized for gait deficit due to MS, for multiple sclerosis. And about 70% of the 1 million patients and growing in the United States have a walking deficit or a gait deficit.
So just to kind of refine this down a little bit, do you want to talk about this PONS device? Exactly how is it operating to help solve some of these neurological issues?
Yeah. So the PONS device in itself stands for Portable Neuromodulation Stimulator, or PONS, and it's a play off the pons gland. And it is an orally applied device. It's a smart device, and it goes on top of your tongue, and it stimulates the two nerves in your tongue, the trigeminal nerve and the facial nerve. And that is a direct pathway to the brain, to the cerebellum. And in our MS studies, before and after functional MRIs were done, in combination with rehab, we showed an increase in blood flow, blood oxygen to the brain. So clearly what we're doing is increasing, of course, the neuromodulation and to a functional change so that a patient in combination with physical therapy can actually have a longer lasting or neuroplastic effect of the brain so that they're able to retrain their arms or legs for gait deficit due to MS.
And when we come back, we're going to explore this a bit farther, but I want you to roll back for us a little bit here and talk about your history. What led up to that aha moment getting you involved with Helius?
Yeah. So a couple things. For 20 years, I ran Maple Leaf Partners. It was a long-short, deep value hedge fund. I was part of Tiger Management for almost 14 years, and we had a very successful run. But in that time, I was transitioning to a different part of my life, and basically I started investing privately and publicly in healthcare companies as an individual and family. And I became a board member of Helius in late 2018, hoping to just help counsel the existing management team. And eventually I became the interim CEO. We had to replace the CEO, and we brought in a whole new team, CFO, a new chief medical officer, a neurologist who's a KOL in herself, Dr. Antonella Favorite Van Pelt. So the aha moment was really the cutting edge ability of PONS therapy to really treat something that is not treated properly.
Well, on that note, I'll pass the question off to the viewers. We'd love to know what you think in that comment section below, and consider subscribing because as news and catalyst in the story continues to evolve, of course, we're going to bring it to you here. But on that, we look forward to catching you in the next one.